Good afternoon. And today we have a pleasure of interviewing my friend, Anna Shats, who is Holistic Bodywork Therapist. Good afternoon, Anna.
Hi, my dear.
Uh, about our channel. On our channel, I would like to explore different aspects of disease called obstructive sleep apnea and offer support for those who are going through different therapies for obstructive sleep apnea and present adjunct remedies to help them to go through the treatment. And the aspect of this disease can be very different. And a lot of my patients suffer from body pain. When they come to the practice, I prepare the pillow to put under the neck to start with. And very often during our conversation, they do different movements. They show me what, yes, neck and shoulders also affected by problem with the sleep and breathing in the same time. And on our channel, I would like to create network of professionals who are passionate about helping people to sleep and breathe in the same time, just like Anna. And I would like medical and dental professionals to use my channel as a networking ground. And in collaboration, we can put puzzles of sleep and breathing disorder together and find the best solutions for treatment of for people who suffer from that silent killer. And again, I want to help people to get sound, refreshing, silent sleep they deserve if they have trouble sleeping or sleep next to the snoring partner. Now, I would like to share our story with Anna. We're actually personal friends for more than 20 years. And when Anna actually arrived to the United States, I was already a dentist. And, I learned about Anna, we become closer. And I said to Anna, you have to become a health professional just like me. You have that amazing charisma and passion to help people. Anna listened and she went to fashion. I love fashion. Everything about fashion attracts me. But then life turned around, and here we are. Hello, Anna, and please tell us the story. How did you come to the world of holistic body work therapy?
Hello again. It's extremely delightful for me to be here. And yes, now hearing you and looking back for more than, I don't know, almost 20 years. Let's not tell anyone how old we are.
We're proud. What we've been friends for that long. That means that we can keep the close connection. And I think it's to our benefits.
You're definitely one of my, probably the only friend, the first one that I ever had in the US, and I'm super happy that we're still friends. So yeah, but going back to how I became a holistic bodywork therapist, you're absolutely right. I was never planning on doing anything even remotely close to it, but the universe had different plans for me. And my life has changed completely with the arrival of my youngest son, who was born very premature. And fast forwarding, a few very painful months in a NICU and etc. During basically his first year, we've learned many things. And when he was almost a year old, he was diagnosed with cerebral palsy. And with that, my story started unwrapping super fast, I should say. I wanted to help my child, and I was looking for different methods of rehabilitation. And with that, I quickly learned that basically traditional medicine will prepare my child to be perfectly comfortable with a wheelchair, but that's not something that I wanted for him. And I started learning and looking into a holistic approach and the entire holistic medicine. And very quickly, I found a method that was called and still is called biodynamic fascial modulation. And it's a combination of osteopathy and craniosacral work. And it became super effective, not just for my son, but thankfully to him and to his, to actually our mutual path in this world, he became my teacher in many aspects of this life. But through him, I've learned how to help others. And how funny it is, 80 years ago, 7.5, I opened up my own practice. And now, because of him, thankfully to him, and because of this beautiful life that we are creating together, I help many people with different types of disabilities, pain, all aspects of health, and here I am.
And this is very touchy story, and for our listeners, you can find more information about Anna and her very, I would say, holistic, very organic approach to treatment on her website BFM Planet, and also through the website and Facebook groups. She has actually two, and I would highly recommend to see what she can offer, because I find that's kind of the future development of medicine, to work with the body, not against the body. And it's so, it's very ironic what we're actually now in the same niche, or we share the same philosophy, which didn't happen through, through the books, through education. It's just life put us this way, which is, planet connect in a very special way. So it's very pleasant. And I would like to ask you, Anna, as a dental practitioner, I get a lot of referrals for people who suffer from temporomandibular joint pain, and a lot of my obstructive sleep apnea patients who cannot sleep well, they also come and say, oh, I grind my teeth and I wake up in the morning with a headache. Here it hurts. I cannot open my mouth. I have like a water in my ear. So many stories. What I learned from that, but it's not only area of discomfort. It usually goes like a domino effect. It goes from the joint to neck to shoulders. Then later on, the medical history becomes so colorful. They said to me, oh, now I'm my spine, I have in herniated disc, or I'm waiting for my hip replacement, or my knee now start bothering me, and then I have a problem with my posture. It doesn't have to be all details of domino. It can be some parts of it. Tell me, why is that?
So why is that? To start answering this question, I believe that I have to explain what holistic actually means. In holistic approach, in holistic medicine, in holistic world, we take body as one whole united system where everything is connected. We don't have an organ that is hanging on its own, right? We don't have a hand on its own. We don't have any muscle that is not connected to another one. The body that we live in is called an organism, as we all know, and it's a system of organs and it's a united system of organs and different systems. All right. So with that, we lead into a very simple explanation. When something is affected by either, let's just put it under a huge umbrella and call it stress, right? It could be physical or emotional. We actually live in a physical body. So even if we experience any emotional stress or emotional pain, it gets reflected in our body, right, on the physical level. And if you picture, put a tablecloth on a table, right? You're prepping for a beautiful dinner. And you see that one corner is a little bit off. So you pull that corner, let's say it's a bottom right corner. You put it a little bit to the right side or down. What happens with the entire tablecloth? Everything gets affected. Everything gets pulled into this direction. You didn't go anywhere. You're not touching other angles, right? You're still here. But the whole tablecloth gets affected, but the super slight movement, right? So exact same thing happens in our body. So if we have tension that is created by either physical or emotional stress, right? And physical could be you fall, you have an injury, right? Something breaks, or you're super tired of offloading, I don't know, truck with bricks, whatever else it is. Your body is going to react to it by a specific tension in different regions of the body. And then you're absolutely right. It's a domino effect. All right. Because everything is connected, and it's connected through an organ that's called fascia.
I would like to ask you, what is that fascia?
So fascia is the most fascinating to me organ in our body. Fascia, I'm a huge fascia fan, as you can tell. I spark when I talk about fascia. I can talk about fascia day and night. Fascia is the second largest organ in our body. So the first largest is our skin, right? And second largest is fascia. Fascia is a huge network. It has many layers. I usually give my clients a very simple example. Think of well, two things. I'm going to give you two examples. One, a tasty dessert, a jelly with, let's put some berries into it, right? And we're going to put it into a specific form so the shape stays in the shape of a form we put it in, right? So you see the jelly with fruits inside, and fruits are staying in the same position because of a jelly, right? So fascia is that jelly. And basically everything in our body, so our bones, our muscles, our organs, right? They all stay in the specific shape because of fascia. And if something happens with fascia, whether it gets twisted or pulled or layers of it, because we have many, many, many layers of fascia, and they are of different length and they're of different elasticity. So if something happens in one place, the other end of it gets affected. All right. So think about it like we have, and again, like let's go back to the same tablecloth. Like one of the largest layers that we have starts here and ends all the way down into your, well, basically heels. All right. So it covers the entire body. We have superficial fascia, and we have much deeper layers of fascia. Another very super beautiful example. I'm very visual when I explain it to clients. So because I
know you are artist.
I want people to understand what they're made of, because I have a feeling sometimes that we know our cell phones much better than we know our body, functionality of a cell phone better than functionality of our body. So grapefruit, right? You peel off the skin of the actual fruit, the thick one, right? Then you separate it into separate pieces. Then you pull that actual fascial layer of a grapefruit, and you have that piece that stays in the same shape. And if you pay closer attention to that piece, you see that it's made of small tears. Each one has its own casing with a little tail, and they all stay connected in that shape, right?
Yeah.
So that it could be not grapefruit, it could be an orange, doesn't matter. But that reminds me, and I want people to understand that looks very similar to our muscular tissue. That how many layers we have, and each individual small piece of a muscle, and we have many muscles in our body, is wrapped in that fascia, is wrapped in that casing, is wrapped in that polybag, if you wish. All right. And if something happens on that small level, you can only measure, because everything is connected, you can only measure what's going to happen to the entire body. All right.
It's going to be affected big time.
Exactly. And fascia is also the first immune system response. It's many things, but mainly whatever shape it is in, whatever happens to it, because it wraps all our bones, all our organs, it connects everything. And connective tissue, well, you'll be surprised, blood is the liquid connective tissue. Okay. All ligaments, they are connective tissue, right? So they just have different density. That's it. And they come in different shapes and forms, but it's all connected.
Fascia. So it's a big organ. It's very important. And for me, that was so fascinating. You know, we deal with fascia all the time because tongue also covered by fascia. So tell me, I have that question about tongue position, and we talk a lot on our channel on every day in the practice. What would be the correct tongue position? And why is that important?
Well, I think we should start with saying the tongue is super influential. It's a muscular organ. There are discussions whether it's a muscle or it's an organ. It has many muscles in it, and I like talking about tongue as a muscular organ. And it acts as a rudder and support system through a fascial line that runs all the way down to your toes. There are many pictures, like you can easily Google it. You can see fascial connection of a tongue, and you can tell and see how far it goes. So whenever I talk to clients, and I'm sure you have same conversations about tongue ties or oral ties, right?
Mm-hmm.
We have to take fascia into consideration. We have to be very
Absolutely.
cautious and be very individual when we discuss things like that, because in some cases it could be helpful, in some cases it could be very damaging. All right. So when we talk about the correct position of a tongue, we need to understand that by being so important and by playing such a major role, we should understand that the position affects not just the entire mouth, but our face, our bite. It could be over, it could be under, the way we breathe, right? The way we chew, the way we speak. So basically, many things get affected by that little muscular organ that is hidden in our mouth. And the correct position is very simple. When mouth is at rest, your tongue should be against the roof of the mouth. I'm trying to press it there to show you where. But it should not be pushing or touching your teeth, whether bottom or upper line. Okay, and your teeth should be little, like when your mouth is closed and it's at rest. Your teeth should not be actually touching each other. It should be like a slight gap in between. And again, the position of the tongue dictates the breathing, dictates the chewing, dictates the face shaping. Basically, sometimes I want to say that it even dictates the way we walk. You'll be surprised.
No, I'm not surprised at all. Like for me, I'm not surprised. Whatever you're saying, that's exactly what I'm teaching my patients, and I'm trying to teach my audience on this channel. So
I
again,
know,
if you
I'm sorry for interrupting you. I think it's crucial and super important. I always tell all my clients, especially the parents, pay attention to how your kids sleep. I often ask them questions. Does your child sleep with the mouth open? They were like, never pay attention to it. Why is that important? Why is that important? Where's the tongue when the mouth is open? Does your child pronounce all the sounds correctly? I mean, I understand I have an accent in English, but it has nothing to do with actually, the sounds pronunciation, right? So people do not pay attention to that. And it's crucial to pay attention to small, like relatively small things like that.
not small at all.
They are big. And again, it affects the entire system, the entire organism.
No, that's such a wonderful answers. So again, if you want to know more about Anna approach to treatment, you can find the information about Anna on our channel and on YouTube. Also, you can find more information what Anna do and a link to get connected with Anna. And this way you can get totally different view on your body and how to help your body. So now I'm going to ask you the questions for kids. You mentioned kids. Thank you very much. What should be course of actions for parents if child complain on a pain in the neck, in the jaw, and so on? What should be, I know in the United States, traditional approach would be to give child the Tylenol. I don't support it so much.
Neither do I.
In our childhood, we had a different approaches how we got treatment. We are on the same page, but now we learn a lot over our course of practice. What would be, from your holistic bodywork therapy philosophy, correct approach if child complain? And I want you to talk about root causes of particular situations.
So I think it's pretty complex. I always ask many questions when I have kids in my practice. And I ask these questions not directly just to their parents, but also to kids. Stress is a huge thing. And we're not mistaken by saying that all our health issues have, basically caused by stress, right? And it's important what kind of stress the child has in school and, daily life, what's happening in the family, all right? Whether or not the child is afraid of punishment, because then again, let's not forget, when we're afraid of something, we tend to do different movements with our body. And our back is basically a shield. So we do this, we hide our neck, right? So then we create constant tension in these muscles. And then obviously the entire thing is going to be affected, not just the upper body, but the lower body as well, all right? The vision gets affected by that. If we're afraid of looking at someone, right? I'm just giving you visual examples again of what could be happening in school, of being afraid of a teacher, or not having good relationship with your peers, and so on and so forth. Right? Then gadgets. My favorite speech when I give to all my teenagers. This is how we sit, right? We constantly sit like this. What happens when we are in position, when our neck and our shoulders, and then obviously the entire spine, let's not forget the tablecloth example, right? I love it for a specific reason. The whole system is going to get affected. Our head does have a weight, all right? And by constantly pulling it down, we pull down the entire muscular and skeletal system. And no wonder everything moves in our body. So we're going to have changes in our body, right? Because the muscular system would have to support this kind of band. And this kind of band is going to make some muscles shorter and some muscles longer, right? It's like basically this type of a game, right? So that's going to create eventually some chronic pain. All right. So that's that. Then different sport activities. I have many athletes in my practice, kids. We're talking about kids right now. Even speaking of my own child, my older son, who's a professional hockey player, we do have
so proud of him.
Thank you. We have many injuries that are caused by sport, and we should understand that aspect as well. And yes, it's beautiful when your child is in a great sport activity, and I'm a huge supporter and lover of sport and physical activities, but everything should be taken with the right approach in life. So if you have very intensive sport in your life, you should also make sure that you have a practitioner who helps your body to get rid of tension, who helps your body to get rid of pain that gets created by overstressed muscles. All right. So that's I don't know if
that's important. So the parents should look a little bit deeper than just pain.
Yeah, it's not just pain. Pain is a signal. Pain is a doorbell. Pain is a phone call from the body being like, all right, we have an issue. Okay, so we're going to call the brain and tell that we have an issue in this region. But this region could be just a symptom. The cause could be in a completely different place. The cause could be created many years ago. The cause could be created at birth. Okay, but it was just not visible. The cause could be the stress. The cause could be a fear. All right.
So the practitioner and parent have to be a good Sherlock Holmes and
that's
really
unfold that secret. A holistic approach. Okay.
Yes.
One whole united system.
Yeah, and I would like to ask you, what would be the story? With the child, parents take care of the child, but the adult have to take care of himself. What would be approach for the adult in that case?
To be honest with you, nothing changes. We get older, we have more issues. It's just easier to treat a child because usually the younger body responds to changes quicker. When it comes to a body that lived for a little bit longer than a brand new one, then it's the same approach. It should be a complex of different things. We again should look into different aspects of your life. Just because you're not brand new doesn't mean that something changes dramatically. It's still physical body. It still gets affected by emotion and physical aspects of what it is that you do on a daily basis. But in addition to that, it's probably like at that point in life, we already have some chronic things. Okay, so that's probably the only change. And when we have chronic issues, we need to take into consideration the aspect of, well, it's the fact that everything is going to be taking a little bit longer. Okay. So you will need more sessions, you will need more things in your life, you will need different types of practitioners working in conjunction, like in order to achieve the same goal. But other than that, it's pretty much the same. Look at your life as a whole one thing, like what's happening in different aspects.
I have, I want to read more to the ends, but I want to ask you a couple conceptual things from you. Mm-hmm. Tell me, as a practitioner, what do you see as the effect of orthodontic treatment? And we do orthodontic treatment. I do orthodontic treatment for 20 years, and we have orthodontic specialists in our practice. What do you see? What would be the right approach from your view when somebody has orthodontic treatment?
It's a tricky question.
Controversial like no tomorrow.
Yes, but I'll be very honest with you. Everything should be taken individually for every single person. We all different. We all have, even though like you put exact same, I don't know, let's say it's the same gender, with the same age, and looking like almost the same problem, right? Have you ever seen teeth to be crooked in an exact same position? No. All right. It's all different. So I always tell my clients, it's very simple. If it's just an aesthetic, let's say I'm going to give you a huge smile right now. I'm not that perfect in my smile, and my teeth, and my bottom teeth are crooked. Okay. And we've done some work there, but then again, it's aesthetic. It's not that it affects my health. It's not that my jaw does not have enough space for all my teeth to come out to the surface. And if we talk about kids in the beginning, and then yes, some older people also have some orthodontic work for whichever reason it is. So I follow the school that believes that if there is a need that is concerning your health, to do the braces system. I almost said it in Russian, funny. So then you should do it. You should do it because you're not going to have enough teeth in your mouth. You're still going to have tension because you're not going to be chewing properly. You do need surface and you do need shape of different teeth. We are created in a specific way, and we do have different teeth for a specific reason. So if we're talking about strictly that, then yes, I believe that that's a good solution. However, the second we put braces in the mouth, we need to understand what kind of tension and what kind of work they do on a daily basis, every second and every hour in your mouth. Okay, we talk about a very strong system that actually pushes on different areas of your mouth, but not just mouth. We have maxilla and mandible. They are connected, and TMJ, the one that everything about, that is attached to our skull. Our skull sits on our spine. So this whole thing gets an extreme push 24 hours, 7 days a week, sometimes for many years. We speak at least about a year or two, right? Usually for braces system. Yeah. So why does it take that long? Because we need a specific shift in our body to take place, right? And nothing happens in our body like this. Nothing ever. That's basically a beautiful concept to understand, because when people come to you, they would like to have a quick fix, right? They have
everybody wants to have it fast.
I know they have a back pain. They want you to fix it in one session, although they've been having it for many months, right? Or even years, or they have scoliosis. They want it to be fixed in 10 sessions. Oh, no, not possible. How come? I always give a very simple example. We go to the gym, right? We go to the gym on a weekly basis. We put some work into our body. We do not expect to have six-pack in, I don't know, in a week or two, right? We understand that it comes with a few months of work, sometimes a year of work, right? To create a beautiful body. So same exact thing happens here. Cavity. It doesn't start with a huge hole, right? It starts with a small dot. And it takes, and sometimes you see it in patients' mouth. You say, oh yeah, you have a small cavity, but we're not going to touch it right now. Come back in a few months, right? So same exact thing happens here. It takes a specific amount of work for the body to create this space. But it's a super strong structure and it's a super strong push. And within this push, changes will be happening in the entire body. The entire system is going to get affected by that. Because remember, it moves. Everything moves. Our spine moves. Our skull moves. It has parts. They constantly, we breathe. There are beautiful videos on YouTube about the way we breathe, and our breathing changes obviously because of our emotions and whatever else physical aspects are affecting our body. We run, it's one rhythm, right? We sleep, it's different rhythm, and etc. So there are beautiful movies showing how our bones are moving.
Bones are breathing too.
They are 100% breathing, and not just here, everywhere. Okay, so be super cautious. And usually I suggest all my clients, when they put the braces system or any type of orthodontic work into their mouth, see specialists, similar, like see specialists in my field, not precisely, I'm only
osteopathic,
one.
yes.
Osteopathic work, craniosacral work, right? We work with cranium and sacrum, cranial and sacrum. I can't speak today. So it's important to help your body, not just to create a beautiful smile, okay? But to understand what stands behind it. And to help your body to get rid of the tension that will be created by this huge push that tries to open up the space in your mouth for the beautiful smile. All right. There is
so beautiful
that stands behind it. And this price is painful. It can create painful things in your body if you don't take a proper care of your body at the right time.
That's nice. Thank you very much, Anna. It was such a beautiful interview and we learned so much. So again, if you have questions for Anna, please put them in the chat box and we'll find you the answer. If you know somebody who have trouble sleeping and pain in the body, please put the like and share button. This way you can spread the word about what we do and what Anna does and help your friends to get a better health. Thank you very much. We're looking forward to see you again, Anna. And thank you to all our listeners.
Pleasure. Yeah, anytime.